Assalamu alaikum. I am Dr. Abdurrahman Muhammad Alam. Welcome to today's cataract surgery insight. I'm going to perform a cataract surgery in the small pupil by avoiding using pupil expanding devices like iris hook, BX ring, Malyugin ring, and pupil stretching techniques. As you know, iris hook requires extra incision in the cornea and it pulls the iris anteriorly, which reduces the AC depth and causes tears in the sphincter pupillae and postoperative inflammation. Bimanual pupil stretch technique also was avoided because it also tears the sphincter pupillae and causes postoperative inflammation. But BX ring and Malyugin ring are much safer, but they also induce some degree of postoperative inflammation. I felt to avoid all this complication, so I did this surgery in this technique. Here the pupil has dilated to about 3 to 4 millimeter. There was a bit of eyelash exposed. I cut it with the plain scissor. Now I'll replenish the anterior chamber with gel. Then I'll commence with completion of this capsulorhexis. I'm retracting the iris to see the rhexis margin of the capsulorhexis before commencing with phaco emulsification and direct chop. Now I perform hydrodissection to tap the center nucleus. Hydrodissection, I feel it is adequate. Now I replenish OVD. Take the phaco handpiece and the cinch key. I see that it rotates. Do a little bit of pre-phaco. Now I'll commence with a direct chop. Yes, it has chopped. Now slightly rotate the nucleus and I'll chop a small piece of nucleus and I'll emulsify it. Yes, in this technique I'll be rotating the cataract and chopping little piece by piece and phaco emulsifying it as I finish chopping. See how I do it. Again I'm rotating and yes, now I chopped another piece. Now this will be brought into the anteriorly and phaco emulsified at the pupillae plane. In this technique I'll continue and remove the whole cataract. Now I'll remove the epinucleus. I have changed the Sinsky to a spatula. Now slowly I'm removing the epinucleus in epinucleus mode. I'm using the spatula to slightly rotate the nucleus, and also I'm moving the iris little bit for better exposure. After removal of the epinucleus, I'm going to remove the cortex. I'm in my right hand. I'm using a dialer to retract the uh, iris or the pupil for better exposure, for better visualization of the cortex. Then I'm easily able to hold it with the coaxial and remove the cortex. Yes, I'm providing very little vacuum in the periphery, and in the central safe zone I'm uh, giving full vacuum to remove the cortex. See how I am removing the cortex? With the help of the dialer, it is easily I'm easily able to visualize the cortex by retracting the pupil. Yes, see how I'm pushing the iris and exposing the cortex. Now I'm seeing where there is cortex. Now I decide to replenish with OVD to form the bag and the entry chamber. Then I take I connect the irrigation line to the coaxial. Then I take the aspiration handpiece of the bimanual. Then I attach the aspiration line to the aspiration handpiece. Now I am removing the cortex with the aspiration handpiece in my right hand, while irrigation is happening through the coaxial. With the coaxial, I'm also with the help of the coaxial handpiece, I'm retracting the iris, and in my right hand there is the aspiration handpiece of the bimanual. I was able to remove the cortex. While injecting IOL in the PC bag, ensure that the leading haptic enters into the PC bag. Retract the iris with the dialer to see if it is going inside properly. Replenish with gel. Again, check with the dialer. Yes, I'm checking if the IOL is inside the PC bag. I exposed the iris in 360-degree manner and saw that the optic was overlapped by the anterior capsule. Yes, my friend, the case is completed now. Now hydrate the incisions with BSS. At the end of the surgery, inject intracameral antibiotic and subconjunctival dexamethasone. Thank you, my dear friends. Hope this cataract surgery insight was helpful for you in developing your cataract surgical skills.